Hello, everyone. I have been highlighting African American Black people that have been making a significant impact or strides in our community or in society. And so I want to highlight Dr. James D. Griffin. He is the first Black graduate of the University of Texas Southwestern's Medical School. But also, he was elected as the first Black president of the medical staff at Parkland Health. Now, you may live in Texas or you may not, and you may be familiar with Parkland Health. And so if you are and you see Dr. James Griffin, stop by, say hello to him, give him a handshake, or even congratulate him. It is so important that we continue to highlight individuals that may never make it in history, but when we highlight them, we're saying thank you for your inspiration. Thank you for your hard work. Thank you that your hard work and your character and abilities are paying off. Thank you for inspiring the generations before, even people in your age bracket. Thank you for being an inspiration. And even when we look back on Martin Luther King's and people like that, and the Rosa Parks, and when we look back over that, over their lives, thanking them for paving the way, but continually moving forward. And even though there's a lot going on in society and we still don't get our due and the respect that we deserve or righteously deserve, or even, who we are as a culture, as people, as Black people. So it's important to highlight Black people that still are making an impact or accomplishments. It's okay to do that. And we don't have to wait till Black History Month, but it's always good to do it because, to do it anyhow, right? And so Dr. James Griffin, he is the first Black graduate of the University of Texas Southwestern, as well as becoming the first Black president at the medical staff at Parkland Health, and also the first to join the school's faculty, as well as the chief of anesthesiology at Parkland Health. And this hospital, Parkland Health, is located in Dallas, Texas. And Griffin, as Dr. Griffin, as a NBC Dallas Fort Worth reported, he shares a special connection with Parkland. He was born in the hospital's segregated wing in 1958. In a segregated wing where Blacks could not be on the same wing as white people. Understand that. When this is the truth. This is not the, be racist or anything. I'm speaking some knowledge here, some jewels here. And in an interview with the outlet, Griffin reflected on that history and his parents, who he says pushed him to believe in himself beyond the limits that society placed on Black people in the Jim Crow South. And that's so important. As parents, you have to push your children. You have to encourage them. You have to train them up in the way that you want them to grow and go so they'll never depart. But getting them to a place where they value themselves and believe in themselves and know who they are to continue to make strides in society. And so to be born at Parkland in a time when my mother could not receive health care in any other hospital was important. Because, there was a lot of midwives during that time, and so to be able to go to a hospital and receive health care. And at that time, Parkland's maternity ward was segregated, so the African-American babies were born in one part of the hospital and everyone else was born somewhere else, Griffin said. But I'm going to say where the white folks was born. The Blacks were separated. The babies, the Black beautiful babies were separated from the white babies, okay? And Griffin continued praising the values his parents instilled in him. See, his parents instilled values, and we have to instill values in our children, good values. You see what I'm saying? It's so important. And he said, we never talked about what we couldn't do. They talked about what you could do. And that's so important. When children are told that they can't do something, we got to encourage them that they can. I remember my son was 7 years old and he came home crying. He said that he was told that he couldn't be on television or act because he was black. And this came from one of his peers that was the same age as him, 7. Can you imagine that? How some parents instill hate in their children. They instill negativity, and that negativity and hate, and adversity spills over into their character and their conversations with your children at school. And I want to say this because it happens. And I told my son, you can be whatever God in his will allow you to be, but you got to work hard. You got to do your part. But what the windows of heaven will open up for you. God will make it happen for you if you walk according to his will and in obedience. And those are the things I instilled in my son. And I tell you, my son's doing well. He really is. Praise God that I don't have to worry about the things that some parents worry about, jail time, guns and violence and gang banging. I thank God I'm not worried about those things, and I never worried about them. But that doesn't mean that they wouldn't be out there and be exposed to it and be subjected to it, because I remember when my son ran home and he told me him and his friend was walking down the street and a car pulled up and asked him what they was claiming. And my son said they looked and said, no, we're not claiming. And then he said they pulled off and backed up, and he said him and his friend took off running because they didn't claim a gang. But I'm just telling you the things that are out here. And so, yes, parents have to instill values in their children. You have to tell them this is what you can do. We know you can do it, but you have to work hard at it. And he said it was always based on faith on what was possible if we put our minds to it. Nothing is impossible with God. And I talk about these things all the time, social issues from a biblical perspective. Nothing is impossible with God. And so in a press release from Parkland, Griffin connected his past and the past of his parents to his historic achievement, saying that it represented significant progress for the hospital and society in general. That's why, you all, it's so important to highlight people that are making significant progress in society in general, and even where they work in their communities or the cities that they work in or their employers. And he says, until I became a second grader, my parents couldn't vote. So being elected by my peers connects me back to a point in time where people like me did not have a voice, Dr. Griffin said. And I want to encourage people to get out and vote. No matter the slim pickings or what you think, get out and vote. God has given you a voice. People paved the way for us, and we got to keep paving the way, because they're trying to put restrictions on voting in certain states, and they're trying to prevent people of color, black people, from voting. Yes, and so it's important to continue to fight. Even your little change of standing up and using your voice, that your voice will be heard and your vote will be counted, is so important. So in order to get here, he says, I had to be voted in by a number of physicians who didn't look like me. How many of us are making waves and strides and progress in society, and they don't look like us? They don't look like us. And he says, to me, that paints a broad picture of where we have advanced in just one lifetime. See, Griffin's remarkable career has stretched over 40 years, eventually becoming a distinguished teaching professor and the vice chair of anesthesiology and pain management at his alma mater. And then in 2021, Griffin was awarded the Leaders in Clinical Excellence Service Award from UTSW. Dr. Griffin reflected on his career, and as the son of 2 school teachers, he has a deeply embedded passion for education. As he told Center Times Plus, service is in my genes. Teaching is in our blood, which is probably one reason I stayed on the faculty at UT Southwestern. Teaching in medicine is a never-ending quest to construct bridges over chasms of the unknown or misunderstood. It is so important to construct bridges, because without a bridge, you can't get across. without a bridge, it's hard to get across. Now, you might get across, but it won't be with the bridge. You might have to take a boat, and their waters could be rough. But bridges, we got to continue to build bridges for other people to cross. We have got to continue to construct and build bridges for other people to get across. Griffin continued, we have a big gap in treatment outcomes of patients who come from under-resourced communities. Yes, healthcare disparities. Healthcare disparities in under-resourced communities. And because of limited access to health care, said Dr. Griffin. But it's true, though. There is a lot of healthcare disparities, and I stated that I'm saying, and he already knows, I know he knows it, but I'm saying there's a lot of healthcare disparities in our community. And if you are in an under-resourced community, you probably have been faced with a healthcare disparity and continually having to fight and being an advocate for yourself. And see, Dr. Griffin, he goes on explaining before explaining that good health care is a public good, and it is a public good. He says, I believe that when we provide adequate resources, good nutrition, adequate housing, and education, the community thrives. So we have an obligation to make sure we foster a balanced society for all. Things that some communities or some races take for granted, we are striving and fighting and struggling every day to have. Let me say that again. For some races and communities that take those type of things, you know, health care and a good education and adequate housing and good food, they take for granted. And there's our community, under-resourced communities, wherever you may live, and you might live in an under-resourced community. People are struggling just to have those things. Just to have those things. So if you're able to be a voice in your community, to be a beacon of hope and light, let God use you to make a change. Even just a simple change means so much. When you see Black females showing you how to grow food to be healthy, that's a change for the good, right? That's a change. When you can become a business owner and you've done it the right way, and you're the first one in your community to own a certain type of service, provide a certain type of service, or own, you know what I'm saying? That's a good thing. That's a good thing. And there are so many other things, right, that are good things. So in Dr. Griffin's new capacity, he will seek to create that balanced society through his efforts at the hospital, driven by a desire to help others. He added, we can change this little part of our earth, like Archimedes, who said, give me a place to stand with a lever, I will move the whole world. So Dr. Griffin, we just want to say, celebrate you on today, recognize you, and say thank you for making strides and progress, and celebrate you, give you a hand clap for your success and your progress and wanting to do good. And thank your parents for recognizing the meaning of being the parents that God had called them to be, because it's so important. And so we just recognize you, highlighting you on this little bitty channel over here, Stand Up, Be Counted too. But I just want you to know that, and I've never met you, I don't live in Texas, but I want you to know we truly appreciate you. God bless you, praying for you, that God will continue to open up windows and doors for you to keep doing good on behalf of other people. Again, God bless you.